Mhm.
Hello.
Yeah, yeah. Can you
Yeah, we
hear
can
me?
hear you, sir.
Okay, good, good.
So
I'm
we'll
all right.
start in some time, sir.
Yeah, yeah. I'll wait. No problem.
Good morning to one and all present over here. I, Dr. Namrata Mishra, postgraduate trainee of Department of Oral Medicine and Radiology, welcome you all in this fifth mega webinar series session. Now I hand over the session to Professor Dr. Satyaranjan Mishra sir for welcoming today's guest speaker, Dr. Nisheeth Saawarn sir. Over to you, sir.
Because we are going to have Dr. Nisheeth Saawarn, who is going to speak exclusively on oral medicine, how to incorporate oral medicine into dental practice. Generally, it is thought that oral medicine is not a clinical branch or it is not having much of clinical applications. However, as sir is going to point out today, how we are going to incorporate into clinical practice, there is lots which can be done through our specialty. And without wasting much time, and thanking everybody who is joined in, especially we have great teachers like Omarji sir, my teacher Arvind sir, and other teachers also. I thank you one and all. Please, Dr. Namrata, introduce Nisheeth sir.
I'm highly privileged to introduce our guest speaker, sir, Dr. Nisheeth Saawarn, sir. Currently, Dr. Nisheeth sir is working as a professor and head of oral medicine and radiology at Bhava College of Dental Science, Bhava University, Bhopal. He has a teaching experience of about 13 years and is in the private practice too since last 12 years. He runs his private dental and oral medicine practice at Dentallin Dental Clinic, Bhopal, along with general dentistry. He actively practices oral medicine and gets multiple referrals for the same from in and around city. He is passionate about interpreting and reporting of CBCT for a few CBCT centers as well. He has done his entire graduation from Rajiv Gandhi University of Health Sciences, Karnataka. He has also done fellowship in forensic odontology and certificate courses in health research fundamentals and another certificate course in interpersonal relations. Dr. Nisheeth sir is a PG guide and chairperson of Institutional Research and Review Board of his institute and the editor for Health Sciences section of Journal of Bhava University. He has about 30 scientific international publications to his credit and reviewer for multiple scientific journals and on the editorial board of for a few. He is a well-known academic speaker and regularly takes guest lectures and webinars in his specialty for institutes in India as well as abroad. He is one of the founder member of Amropin and a life member of IAOMR. Please join me in welcoming Dr. Nisheeth Saawarn, sir. Over to you, sir.
Can you hear me?
Yes,
Can you
sir.
hear me? Okay.
Yes, sir.
So, thank you, Dr. Namrata, for introducing me. And good morning, everybody. I'm like there are so many my teachers present here, my seniors present here. I bow my head to you all for the blessings and thank you for keeping me, giving me support. I am Dr. Nisheeth Saawarn, like she introduced me. And first of all, I like to thank Dr. Satyaranjan Mishra, the head of the Department Oral Medicine Technology of Institute of Dental Sciences, Bhubaneswar, for giving me this opportunity. And then I also like to thank Dr. Neeta Mohanty, the Dean of this institute, for providing me this opportunity. I'm very much thankful to my team Amro Pin for constantly supporting me throughout for all this work. Today, I'm here to talk about the role of oral medicine people in general dentistry practice, or how or why a oral medicine person can excel in general dental practice, or rather more than how, why an oral medicine person excels in general dental practice. I'm going to elaborate on those. Private practice is my passion since beginning. Since the day I joined this course, probably after a few days, I started thinking and dreaming of having a clinic and doing exclusive private practice. And probably I am doing so. In academics, I am by default for various other reasons, practical reasons. But my passion is private practice, and I pursue that with my heart and soul. Okay. So today I'll talk basically about why oral medicine is good for doing private practice, and I'll tell you why this notion that people in the oral medicine cannot do private practice is wrong. I'll put my points on that. But before that, let's first understand what is the scenario of private practice in India. Private practice, I mean private dental practice in India. When you come to private dental practice in India, we have three or four types of setup where we do private practice. First and foremost is the rural setup in the villages, or more than villages. Actually, these are small, small village markets where there is a conglomeration of 8 to 10 villages. There are small markets where we put up practices. Small towns, big cities, larger cities, and metro cities. The scenario of practice differs in all these areas for various reasons. When we come to the village towns, small towns, villages, and village markets, and sometimes even smaller towns, your degree doesn't matter. Sometimes even if you don't have BDS, you can practice. That's a different story. But whether you are a BDS or an MDS, that doesn't make much difference. All the people need there is a good dentist. While when you come to smaller, a little bigger towns, or the capital cities of a state or equivalent cities, your degree does matter. People awareness has started coming, and people look for MDS degree, though they are not aware about a specialty and they don't care which specialty you belong to. But an MDS degree does make a difference. When you go to metro cities like say Pune, Bangalore, Delhi, Calcutta, then in those cities your specialty too matters, and people are gradually becoming aware and educated, and they look up for you to be an endodontist or orthodontist or oral surgeon and look for them. So what I mean to say that a post graduation degree is by and large most of time required to do a private practice. If you want to do a good private practice, by and large postgraduate degree is required. The reason being that because of the reasons for the cost, or the other scenario, the cost of the dental treatment, the cost of the materials, or the recovery we want, or the our passion for doing some good quality treatment. Most of us want to set up our practice in cities, not in rural areas, and hence your degree matters. Now, in which branch you should do MDS, I'm not going to advocate on that. That should be pure a person's choice, and I think a person should do PG in the branch he is passionate for or he likes. Okay, so this is one aspect of practice. That is how your degree is important and what are different sectors of practice. There is another aspect of private practice that we all suffer from. That is how we are different from medical line. A person holding a MDMS degree and a person holding an MDS degree, how these two differ in market while doing private practice. Those who are having MDMS degree, means the doctors, medical professional with MBBS and MDMS degrees, they are all considered specialists. They have already diversified. People are aware about diversification and they choose to go to those specialists for what they want. I think it has taken a long time for this awareness. Probably when I was a child, or when most of you were child, the MDMS degree did not matter, and all the people wanted to shoot to a doctor, and even MBBS doctors did well. But they have increased their awareness among public. Now, even for a normal cough and cold, you like to go and shoot to a pulmonologist or a chest specialist. So, 10 people who have passed out MBBS and have done MDMS in 10 different specialties, when they are sitting in one market or one road, that is considered good. The patients feel happy that all the specialties are there, and if I go there, I can meet all the doctors, all the specialist doctors, whatever is required. While when the scenario is opposite for us, when there are 9 dentists with 9 different specialties of doing done MDS in 9 different specialties, sit on the same road or in the same market, it is not considered good. We all feel competition from each other. Not only that, the public also feels that there are a lot of dentists there. And we are all considered general dentists. Either you are a BDS or MDS, an endodontist, prosthodontist, surgeon, oral medicine, especially oral pathologist. It doesn't matter. We are all considered a general dentist. So the onus, I think, lies on us to create awareness. We have to create awareness about our specialties to general public. And I think this can be very easily done by prominently positioning our specialties on our boards, ads, everywhere. And other than general dentistry, we should write that we are doing this practice. And probably it will take some time, but the awareness will increase and day will come when dentists too will do a specialist practice. And that will be a very blessed day for our profession. Maybe we will not, maybe we may not see, but probably our next generation of dentists will see. So that is another thing which is important. By and large said that if you see the overall current scenario, we all have to practice the general dentistry and all the specialties that we have to, all the work we have to do. There is no escaping from that. And we cannot say that I am doing only oral medicine practice or I am doing only prostho practice, I am doing only endo practice. There are few people who do that, and that is good and commendable. I like that. So now let's see what are the qualities that a dentist should have for doing a practice. But first we'll see how is the scenario in a clinic different from the scenario in a college. When a UG student or a PG student, when he passes out and puts up the practice, what all challenges he faces and how he has to cope up. I'll give an example. Suppose you are learning swimming. When you go for learning swimming, usually learn swimming in a swimming pool where you have a coach, you have a lifeguard, and you know how deep is the water, what is the width of the pool, what is the depth of the pool, how cold is the water, how warm is the water. So everything is there. You out. That's the scenario in the colleges where most of us learn doing our work. Will we acquire the skill of dentistry either in UG or PG. But sorry, imagine I take you out of that swimming pool and put you directly in the what you say in an ocean or a river, middle of the ocean or in the river. Now the scenario is totally different. Though you know swimming, the challenges here are immense. You don't know the depth of the water, you don't know the temperature of the water. You may have to fight with the animals, maybe shark, maybe some other fishes, maybe some other marine creatures. There might be sea currents. The river might be flowing in your opposite direction. So there are a whole lot of challenges. This is the same scenario which a dentist faces when he reaches the clinic. When he reaches in his clinic, he is his own advertiser, his own marketing man, his own PRO. He is the legal advisor, he is the financial advisor, he is the auditor, and he is the dentist. So the challenges is immense, and sadly, it is not being taught in our course. And I feel it should be taught not as compulsory but as an elective sources. And there are so many people here who are in the position of authority, and I'll request most of them, all of them, that they can start it as a at least as a side course or a small lectures to their interns so that they will be able to face this scenario. Now, so this is how the practice is different. So to run the practice, we have to acquire a lot of skill. We feel, or most of the students or the dentists feel, that if we have learned the skill of doing doing a work, a clinical work, maybe any clinical work, then that is good enough for doing practice. No, it is not so. I'll give you an example. Suppose you are supposed to buy, say, a very cheap thing, a dairy milk or a packet of salt, 5 or 10 rupees, maximum 20 rupees. You want to spend, and you go to a shop. Now imagine what all you expect from that shopkeeper. You want him to be well behaved, okay? You want him to have a very good attitude. He should be friendly to you. Doesn't matter what you are buying. You may be buying just 1 rupee chewing gum. Still, you want him to be friendly to you. You want him to be non-judgmental to you. That what you are buying, he should not be commenting what you are buying only 1 rupee thing. No, You should be non-judgmental to you. He should understand your needs. He should be hygienic. His shop should be organized, well organized. His charges should be reasonable. He should be smiling to you. He should be friendly to you. There's so many things that you look for in that shopkeeper before buying that. Now, even if you don't get that item there and you have to buy from some other shop, still next time you will prefer to go to the same shopkeeper if he has these qualities. While even if he have all the things in the world at a cheap rate, but he doesn't have these qualities, then probably you will not like to go to him again. The same things, the same quality, a patient looks for you as a dentist, as a doctor when it comes to your clinic. He wants you to have a very good attitude. So these are the attitudes or these are the traits which are required for a private practitioner. What are those? You should have very good, your attitude should be positive and good. You should have compassion for the patient. You should have empathy for the patient. You should understand his pain, his problems. You should not be judgmental towards him. You should not be passing judges to him. You should be a very good listener. You should listen to him what he tries to say is, and many times it is very helpful to listen to him. Though he may be telling a huge long story, still you have to be listening to him. You should be a good counselor. You should have a positive behavior. You should be smiling, ever smiling, like those businessmen sit in these ladies garment shops. They ladies go there, they ask for, I'm sorry, I don't mean to offend anybody, but you go to a shop and they will ask you for 100 types of clothes, then they say, sorry bhaiya, I don't like this. The shopkeeper still keeps smiling, though he might be cursing in his heart. So we have to have the same attitude. You should be smiling, and all these traits you have to. And again, the most important thing, you should be able to diagnose the disease properly, point out his pain, what's the problem he is having. You should be able to explain it to him that yes, you have this problem, and then comes the part of treating it. And of course, you should not be much money minded, though money is important. But believe me, if you follow this, things, money follows. Okay, so these are the traits required in a general practitioner to do other than his skills. Now, I'll come to the oral medicine part. Many people have a notion, like Dr. Satyaranjan Mishra also pointed out, that oral medicine is a non-clinical branch, and we don't learn much of clinical work here, and hence it is not good for private practice. So, if you are an oral medicine specialist, you may not do well in private practice. But what I have seen in my personal experience, and that all those people who are doing private practice, means all those oral medicine specialists who are doing private practice are doing extremely well. They are doing extremely well. I have innumerable examples. I think I should start when I was doing my PG. I saw first my two PG teachers, Dr. Shashikant sir and Dr. Ali sir. I think those two people who were actually full-time practitioner and a small city like town like Davangere, they will be counted in one of the five best practitioners of the town. My principal of my UG college, Dr. K.S. Ganpati sir, he also had a very good practice. And then I have seen many people. I think Gandhi Bausa's clinic have gone to Hyderabad. Then Dr. Prashant Saawarn sir in Mumbai. There are so many people in any town, every town, wherever I see that any oral medicine person who is doing practice with his heart and soul is considered always one of the best in that town and one of the best in that city, and is highly successful. So, what is the secret of it? So secret of it is not that he has learned endodontics and he learned implant. The skills can acquire, anybody can acquire anything, but why he is excelling. So I'm going to explain that why he is explaining. Why these people excel and why oral medicine people who have learned oral medicine properly in their post graduation, and those who are practicing oral medicine with their full heart and soul in their general practice, they are putting everything that they have learned, are doing extremely well in their practice. Why? So for example, well, I'll come back again to the shopkeeper's story. The first quality needed was your attitude, your ability to communicate, your ability to listen, your ability to have compassion and empathy with the patient. Now, see the example of a dental college, as a postgraduate clinic. The patients, when they walk in the college, the first department they visit is the oral medicine. And remember, it is our nature that whenever we are in pain or trouble and we find somebody sympathizing with us, the first person whom we meet, we narrate all our stories. We pour out all our agony over there and we try to relate with them. If that person is sympathetic to us, we have a very good bondage with them. The same thing happens with oral medicine postgraduates. When they are practicing oral medicine, all the patients come first to them and they tell all their stories, all their pain, all their problems. And through a constant practice of this as a intern in post in the department, as a postgraduate post in the department, or the faculty in that department, gradually we cultivate the habit of having very good listening skills, filtering out the matter of interest for us, means filtering out the information which is needed for putting in diagnosis, and having a empathy with patient, having compassion with patient, and this helps us relate well with the patient. This is one skill, a very important skill, which is highly helpful for us while doing our practice in our clinic. The same quality is very important and patients really have a very good bondage with you. He might have an ulcer over there. If you ask him how did you develop, he'll start telling a story कि कल रात को मैं अपनी बेटी के घर गया था, वहां खाना खाया, अच्छे था, लेकिन साहब मैं तो अपना ब्रश ले जाना भूल गया था, उसने सुबह गांव पे था, उसने दातून दे दिया, वो दातून करते करते छाला आ गया. If you don't listen to his whole story, probably he will never be satisfied. It happens with us also. You go to repair your car, get your car repaired. We tell so many information which is actually not required for to point out that problem, but we don't know that those problems, what we narrate to that engineer are not related to the problem, and the engineer listens to it. If he doesn't listen to you, you don't feel satisfied, and probably you will not be satisfied that workshop. Same thing happens when we go to doctor from some other ailments and we tell him all the stories. So same thing with the patients also. When they come to us, what they are telling us may not be important for us, but it is important for them for their disease. So while doing oral medicine, we develop very good listening qualities, an ability to develop empathy, an ability to develop compassion, and thus we develop very good bond with the patient. Those bonds help us grow in private practice, and this is one quality which really helps in building private practice, and probably that is why most of the oral medicine practitioners are very successful. Now we are coming to another problem. There is another joke going on in all the dental colleges. I think all of you will agree here that dental oral medicine department is a traffic police department. I had a very senior faculty, Dr. Srinivas Raju sir. I worked with him in Kanpur. He used to say that we are like oral traffic police. We keep directing people here, go there, go there, go there, go there, everywhere. But imagine you are standing in a busy city, say Bangalore. The traffic of Bangalore is well known to most people. And the traffic police person standing on that circle does not know which traffic to be diverted where. If he is not knowing which traffic to be diverted where, imagine the chaos that will occur at that place. There will be full chaos, traffic jams, snarls, balls, out, brawls, everything will start over there. So mistake of one traffic police and so many people will suffer. That means the role of traffic police is very important. What I mean to say that in oral medicine, when the patients come, we diagnose, we point out what the disease is, our ability to diagnose disease and to formulate a treatment plan. To formulate a proper treatment plan in a proper sequence helps us a lot. So in our 3 years training of post-graduation and probably a few months in internship and some types as a faculty also before we start put up our practice, this our ability to exactly pinpoint the diagnosis, exactly find out what the patient's problem is and what treatment needs to be given and in what sequence, that makes a hell lot of difference to our capabilities. So I'm not comparing with any other branch people that what they are capable of or not. My topic's not at all related to this. And I'm only talking why oral medicine people I feel is better. These are my personal views. Some of you may differ from it. Some of you may agree. Some of you may not agree. So our ability to formulate a proper treatment plan helps a lot. Now, according to our treatment plan, in our clinic, we may not be able to provide all the treatment ourselves, but we will be able to convince the patient that what all he needs to do, and we will be able to provide the treatment to him. So patient, when he sees that his problem has been listened, understood, addressed, and a full proper program for his rectification is produced to him, he is always happier and more satisfied. Again, he will have more faith and bondage with you. Now, coming to the skill, see if a patient requires 4 types of treatment, 2 types of treatment may be able to do, 2 types I may not able to do. So skill can always be hired. Skill can always be hired. We can always refer a consultant, call a consultant and get the treatment done, and the patient will be satisfied. Probably that is another reason why most oral medicine people are doing well in their private practice. They may not have all the skills required. For that matter, no dentist can have all the skills required, and that is why we have the consultants doing our jobs. And that is a good practice. I feel we should encourage consultancy. We should always call our colleagues for our cases, and that will again help in growing our practice. Patients too feel satisfied. The you too feel satisfied by providing a good treatment. It is the story of the same shopkeeper I told you, that you went to buy a packet, say a dairy milk. He may not have the dairy milk. He may refer you to the another shop for that dairy milk, or he may acquire it from another shop and give it to you. Still, these other aspects are good. You will prefer to go to him than to a shop which has hundreds of dairy milk packets and who is not well behaved. So that's the difference. So even if you are not able to provide that skill, you are not yourself providing that skill, you can always hire that skill. Though this is another very important aspect for why oral medicine people are doing well in their practice. Now I come into the third aspect. Third aspect is the diagnosing the proper treatment. All of you people who are doing practice, who are doing oral, who are having clinics, and who have advertised themselves as an oral medicine practitioner, or those whose colleagues know that you are an oral medicine practitioner and working in the city and doing a general dentistry, you have a clinic, you will be getting such referrals where when everybody has tried everything from their end and everybody has lost hopes, then they will send the case to you. I keep getting such cases from many dentists in and around Bhopal. They've tried everything and they come to you. Now imagine a patient comes to your clinic with a file having 100 papers of prescription and tests done by 10 to 15 doctors, ranging from dentists to the ENT specialists to physician to neurosurgeons. And when you are able to diagnose that disease and provide the correct treatment, and his pain gets relieved, believe me, the faith he will have in you will be immense. And that patient might be paying you only consultation, but his whole family will come to you and he will advertise a lot for you. That is one satisfaction which you will get. And probably that is another reason why oral medicine people are doing very good in their practice, that we are able to diagnose the disease properly. And the vague diseases, it's not about dental pain. Most of the time we get about the some lesions in the mouth, some red, white, yellow lesions, some growths in the mouth, some swellings in the mouth, which are not common. The pain in the face, jaw, and the mouth, the burning sensation on tongue, the feeling of weird feelings, itching sensation. Such type of patients, when they are treated by everybody and not cured, they will always refer to you. So it is always good to treat such cases, and when we treat such cases, we are always beneficial. Same thing happens when a person is your patient. He comes to your clinic for you only, and you find out some lesions in his mouth. He has come for tooth pain. You see a lesion like lichen in his mouth, and you ask him, "Do you have burning sensation in the mouth?" He would have suffered from such a long time that he would have forgot about it. He would have taken it as a part of his life, like how we have accepted Corona as a part of our life, and he is living with it. But if you offer him that he has this treatment, first he is stuck that how this doctor know it. No one else is seeing it. No one else has realized it. And then you treat it. He's cured, then he is happy. So that is third reason why I feel oral medicine practitioners do very well in their practice. They are doing immensely good in their practice. Now there is another problem, another aspect, that is the interpreting good. I'll tell you some cases regarding this. Recently, I had a patient, not recently, 3 years back. There is a neighbor of mine who stays just behind my clinic, and he is a manager in Johnson and Johnson Pharma. And his mother had pain in her jaws, and believe me, she suffered for 2 years. 2 years he has been showing to all the doctors of Bhopal, Lastly, one ENT specialist told him that why you are wandering here to there, you go and show to a good MDS dentist. Then he realized that one MDS dentist is right next to my house. He came to my clinic. It was simple. There was mild clicking and pain in the joint. I made one splint and gave him. And within 15 days, her pain was gone. If within 15 days her pain is gone, what she has suffered from 2 years, it has been more than 2 years now. She is very happy. So this makes a lot of difference while building trust with the patients. Now his whole family is my patient. I have done orthodontic treatment for his two daughters. There is another case. There is an elderly gentleman who has burning sensation on the lateral aspect of his tongue, and he keeps seeing his foliate papillae and says that these are red and I have pain and I have burning sensation. He too has visited numerous dentists in the Bhopal, some neurosurgeons, ENT specialists in Bhopal and the next city, Indore. He went to the clinic of one of my colleagues who is an endodontist. So she sent him to me. When he came, I provided some medication. I explained him everything, counseled him. Now he is very well. He is doing good. So such patients make a lot of difference. There was one more lady who had simple lichen and who was staying in Gurgaon. And in Gurgaon, she has struggled for more than 6 months. Nobody is able to treat her. Probably, unfortunately, she did not go to an oral medicine specialist because people are not aware. Her brother is in Bhopal. She came to Bhopal. Then he brought her to my clinic. It was erosive lichen planus. I gave few intralesional injections and some tablets. I need not say, all of you know that what treatment I would have given. She is very happy. So, it's not like I am boasting myself. All of you who are doing practice either in colleges and cases would have suffered many such instances like that where you have treated such cases. Most of you are very senior to me and you have seen more than hundreds of such cases. I'm just giving example 2 or 3 cases. I'm much junior. So, what I want to stress is that this is the quality of oral medicine specialist, which helps him growing in practice. Now, the fourth most important quality, which I feel, is interpreting radiographs and especially CBCTs. There are so many people now who have their own CBCT centers. They get the CBCTs, but they prefer not to get the reporting done for saving the cost. There are many practitioners like this in almost every city who are good practitioners who are not from oral medicine, who have their own inbuilt CBCT centers. They do the cases CBCTs. They see probably they are very good at choosing the implant side, but not at other things. And there we have an edge. I'll tell you an incident. There is a patient, one Muslim patient. He came to me, I think 2 years back. He came to me with his mandibular teeth, canine to canine, not canine, premolar to premolar RCT was done. All teeth were root canal treated, and he has got it done at 2, 3 different clinics. His main complaint was that he was having burning sensation and slight itching sensation in his lips, lower lips. He went to a dentist, one of the most famous dentists of Bhopal, he has his CBCT center in his own clinic, and they found out that you should get a RCT done for 3-1. So he got it done. Still, the pain was not relieved. So they did for 3-2. Still, the pain was not relieved. So they did a CBCT. They did not find anything in the CBCT. He kept that CBCT, and thus way they did again 4-1, 4-2, and 3-2, 4-3, and 3-3. Then he visited another endodontist next to his house. That endodontist treated both the premolars, but his pain was not sufficient. Then that guy, that endodontist, he was another faculty in my college, and so he referred the patient to my clinic. I was also wondering what it is. So my first intention was to treat his burning sensation, which I treated. He was relieved, but his pain did not go still for those anterior teeth, for which he has got all the premolar to premolar root canal treatment done. I asked him that I think you should get a CBCT done. I like to have a better view. He told me, sir, वो तो मेरे पास रखा है, बहुत दिनों से रखा है. So मैं आपको CD ला के दूंगा. So he got me the CD. Next day he got me the CD. I came home and analyzed it. There was one simple problem that his 3-1 had 2 canals and the lingual canal was not obturated. But the CBCT was done. It lied with the patient. She went through 3 or 4 dentists. All were aware that CBCT has done. They all had seen it, but they were not able to find out that the second canal was not filled, which was the cause of the pain. And for that, he has got his treatment done from canine to premolar, all the root canal treatment done. I sent the patient back to that endodontist and told him, please do it. This is my policy, and I think all of us should follow that. When that the patient comes to us for oral medicine referrals, we should do only oral medicine treatment and we should send the patient back to the referring dentist. No poaching of patients. If we do not do poaching of patients, we send the patients back to them. If a patient comes to for ulcer in the cheek and the patient is scared that he has carcinoma, and most of you will be getting such referrals, all you need is to do is to remove that offending tooth. Please do not remove that tooth. For that removal, send the patient back to by writing a note and explaining the patient to the dentist who has referred to you that kindly remove this tooth. This will help building trust among our colleagues, and this will help us grow. And I believe, and I think, I strongly believe that most of us do that. Most of us who are doing good practice habits, they always refer the patient back and do not poach on patients. It's not a good practice, and ultimately keeps us growing. So these are 4 5 traits which I believe help oral medicine people increase it, and we all should build up that trait while doing post graduation. This topic I love talking, and I think I can keep talking for hours. But time doesn't permit. I think it's already spoke more than half an hour or 40 minutes. So to summarize, what I'll say that why oral medicine people are doing well in practice. I'm not going to say how you can do practice. I'm also not comparing that why we are doing better than others or worse than others. My job is not to do that. I'm only telling that why oral medicine people are excellent practitioners. And any oral medicine person who is having a practice is an excellent practitioner in his or her town or her city. You have to just open your eyes and see around. And this notion that we are a non-practicing branch and non-clinical branch will go off. It is not so. Everybody who is doing practice is doing excellent practice. But first and foremost, we have got very good communication skills with our teaching. With our teaching learning, what we have acquired in 3 years, we have got very good communication skills, very good learning skills. We are very empathetic patient. We have good compassion with the patient. We are good at building rapport with the patients, and we are good at doing counseling. Many cases just get cured by counseling and sympathetic words, especially the all these oral medicine cases which are caused due to stress and the anxiety. You just talk to that person. Most of the time, ladies, the middle-aged ladies, they have problems in their household, either with their in-laws or husband, or for any reason. All you need to them is to segregate them, talk to them empathic nicely, and when you do the counseling to them, many a times they cry out and they tell all their stories, and believe me, most of the time their disease is cured. All of you will agree with this who all are doing the oral medicine practice. So our skill with counseling help us a lot, which we learn thoroughly in the 3 years of post graduation. Then our ability to correctly diagnose the disease, correctly point out the disease, not running here and shelter, not getting diverted by his various problems, and correct diagnosis and formulating proper treatment plan again helps us in giving us a making us a building our practice. This is another trait which is very important. The third trait is that taking referrals. We are able to treat or diagnose what no one else can. I'm sorry I'm using this word. Probably some people might feel offended, but this is the truth. We are going we are usually treating what no one else can. RCT can be done by anybody, an FPT done can by anybody, an implant can be done by everybody, a rehabilitation can be done by anybody, a past partial done can be anybody, a fracture can be repaired by anybody. But what an oral medicine specialist touch, no one else can do. And most of the time, you get cases when everyone else has failed. When everyone else has failed in your city, then those patients land up at your door. And when those patients land up at your door and you treat them, imagine the trust you are building with the patients. And these are, I think, 3 or 4 qualities which help us become very good practitioner. And probably that's the reason that all the oral medicine people are good practitioners. So I'll request all those people who are thinking or who are in dilemma, especially interns and junior student, that shall we take up oral medicine or not? Will it help us in practicing or not? Will I be able to do a good practice? Then believe me, trust me, you will always become a very good clinician. And other skills everybody learns. An endodontist learns how to do prosto work, a prostodontist learns how to do endo work, an oral surgeon learns how to do endo and prosto work. all of us to learn has to learn each other's skills. And that is one thing, again, I believe that in fact dentistry should be a super specialty of medicine, or there should be some branch where we treat everything as a general practice. Anyway, that's another matter of contention. So with these words, I will like to finish this talk over here. And I'll thank you all for listening patiently to me. I thank all my seniors, all his students or colleagues for being here. I thank Dr. Satyaranjan Mishra and his team and all his department colleagues and postgraduate students for conducting this webinar and giving me this opportunity. I'll also again thank the Dean of the Institute of Dental Sciences at Shiksha Anusandhan University, Dr. Neeta Mohanty, for giving this opportunity. Thank you all. Thank you, everybody. And Dr. Satyaranjan Mishra, over to you.
Thank you so much, sir, for your interesting and very informative lecture, sir. We feel very elated with your session, sir.
Thank you, madam.
So, shall we proceed with the question and answer session now,
Yeah,
sir?
please.
So, first question by Dr. Ruchika Prasad, ma'am.
Yes.
Sir, in this times of social media where images are posted to questions asked, the focus is on treatment. What diagnosis and what are your views on this and how to tackle this?
I think we cannot treat or give diagnosis by just looking at few pictures. Most of the time, we may be correct because one single picture and without any narration will tell half the story. And I'm not for it. I don't support it, and I'm not for it. But when it comes to teleconsultations, yes, I am in for it. We must do teleconsultation, and I do teleconsultations for most of my friends and colleagues, and I charge them also. If they ask me questions, sometimes it's okay. But if it is like constantly happens, there are few dentists who keeps constantly asking me every day they send referral. Then I tell, I'm sorry, dear, I'll be charging you, and I usually charge 400 to 500 rupees per teleconsultation. And I think all of us should do that. So if somebody posts like that, we can give a general answer, some vague, something which is in general, but we cannot give a specific treatment. It is not correct also, and I don't support this. But teleconsultations, yes, I do support.
Thank you, sir. So, next question is also from Dr. Ruchika, ma'am. How to explain to those doctors who jump into treatment planning on the basis of such posts?
On the basis of?
Of such posts.
You can't make them understand. Those who are not able to understand, you can't make them understand. People no, half knowledge or ignorance is not good sometimes. So, we can't help them. They and their patients suffer many a times. Gradually, with time, they will learn that this is not correct practice, and with time and maturity, they will learn how to proceed further, and they will come on the right track with consultations. Yes.
Thank you, sir. So, another question from Dr. Amita. Should the subject be highlighted at an undergraduate level, emphasizing its clinical scope of diagnosis and treatment?
Of course, it is. Of course, it should be highlighted. It is very important to in our department, the department which you are heading or where you are teaching, to continuously expose students to your patients where you have treated well. You can show them that how oral medicine is helping them. Most of the time, what happens, they just record the case history, take two radiographs, and finish off the posting. That needs to be changed. We have to involve the UG students in the PG teaching, show them the cases that are being presented, that are being treated. When they see something which they have not seen other department, and they see that the dentistry has such a phase also where we do treat such cases, that will help them in either choosing oral medicine as a specialty, as a career, or all consultants of oral medicine when they suffer this, see these patients. Many times the dentists are clueless where to refer such cases, and they just try to give any ulcer, they try to give Kenacort, any ulcer, they try to give Mucopain, any burning sensation, they try to give Vicosol capsules or some antioxidants what is prescribed to them by MRs. So if we start exposing UG students to interesting cases, maybe cyst, tumors, or oral lesions or burning sensation, that will help a lot in building up the fraternity, and it will help us raising the standards of our specialty.
Thank you, sir.
Hmm.
So we have received an incredible response with more than 250 participants over Google Meet, Facebook, and YouTube, sir. And
Thank you,
now I
madam.
hand over the session to Dr. Smita Priyadarshini, ma'am, for vote of thanks. Over to you, ma'am.
Sir, I vow by whatever you said. It is actually us who could give some respect to our specialty. On this note, on behalf of the organizing team, I take this opportunity to thank those who have directly or indirectly contributed to the seminar. I express my gratitude to our esteemed founder, President, Siksha Anusandhan, deemed to be University, Professor Manoranjan Raya, for his unstinted support for all his academic activities. I sincerely thank Professor Ashok Kumar Mahapatra, Honorable Vice Chancellor, Siksha Anusandhan, deemed to be University, for his ceaseless support. I'm obliged to our driving force, Dean Professor Neeta Mohanty ma'am, who had visualized this webinar series. It's with great pleasure I thank Dr. Nitish sir for being part of our webinar series and enlightening us on this enigmatic topic so lucidly. I'm obliged to Dr. Shalu Rai ma'am, Honorary General Secretary IOMR, for her support, and gratefully acknowledge Team Amropine for their cooperation. I also thank Dr. Satyaranjan Mishra for organizing this mega webinar series, getting the stalwarts and experts to talk on topics of clinical importance and execute it so smoothly. One spirit, one team, one win. With this note, I thank my colleagues, Dr. Sanat Kumar Bhuya, Dr. Rajat Panigrahi, Dr. Abhishek Ranjan Pati, Dr. Bashant Kumar Chaudhary, along with all the efforts of a hardworking, diligent, postgraduate students, Dr. Rupsa, Dr. Sushmita, Dr. Subranita, Dr. Namrata, Dr. Purvasa, and Dr. Anamnika, who have made this possible and coordinating every minute details. I thank our participants who've made this most of this academic event. I thank you one and all as we move towards the end of this today's webinar. Thank you so much, sir.
Thank you, madam. Thank you, Dr. Satyaranjan. I'll
Thank
leave
you,
the
sir.
meeting room. Yeah, I'll leave the
Thank you,
meeting
sir.
room.
Okay, sir.
Okay, bye. Bye.
So tomorrow we look forward to a great learning experience by Dr. Hemant Umarji, sir, who's a stalwart and a legend in the field of oral radiology. So see you tomorrow, and it's bye-bye from us.
Thank you, sir.